All right, we're going to go ahead and get started. Good afternoon, everyone, and welcome. I'm Kelly Bullard Dunn, and I'm here with Dr. Lucrease Kidd, and we are so thrilled to start our community-based participatory research seminar series with this presentation today. So, because this is our first seminar, I did want to just spend a few minutes giving you the background and essentially answering why we are here. So, Dr. Kidd and I lead the community engagement and outreach core of the new Louisville Clinical and Translational Research Center, the LCTRC. This is a new and very exciting initiative that's funded by an NIH grant as well as contributions from the university. You can see on this slide sort of the org chart. The center is led by Dr. John Klein and Dr. Zhaipeng Wang, and it's made up of 4 cores that represent really the aims and the goals of this project. Ours is the Community Engagement and Outreach Core, and the purpose of this core really is to improve the overall health and well-being of our citizens by raising awareness of community health research needs, and then to improve access of that. The CEOC for this particular project has 2 initial target regions. One is in the Louisville region, primarily West and South Louisville in our urban core, and then a second more rural region in areas around Owensboro. Well, the purpose, again, of the CEOC is to strengthen our partnerships with the community, and this does require promoting health literacy and, most importantly, trust. You're going to hear a lot about that today. To advance community-informed research by supporting community-led as well as investigator-initiated community-based research. To improve access to research and resources and raise awareness of health needs, and then to ultimately empower citizen scientists and other stakeholders to be actively involved in all parts of the research mission. So, what is community-based participatory research, CBPR? This is an important question to answer because there are lots of ways of thinking about community research. There is research that is focused on topics that are important to the community. There is research that involves community members as subjects. CBPR is actually fundamentally different because it is based on a collaborative approach. It equally involves members of the community, all stakeholders, in all phases of the research process, not just as subjects, but actually as co-creators of knowledge. The principles of CBPR are on this slide: co-learning and shared decision-making, a focus on relevance to the community, which means that we need to understand what the priorities of the community are, then building on the community's strengths and resources. We often talk about community needs, but we rarely focus on the strengths. What's there? What can we build upon? Making a long-term commitment and sustaining these. So this isn't just a one-off. We come down from the university, we do a study, we send out the results, and then we leave. This is to be sustainable. And then finally, to ensure that all of this is based on mutual benefit and equity. This diagram just basically shows how we go from really a lot of what is more traditional research here in the Inform. We share information about research with the community, to actually asking them what they think, engaging them as participants. But here's where it really starts to change, really starting to get the community's input on initiating studies and then fully integrating them into all phases of design, execution, interpretation, communication of those research projects and results. Ultimately, with the goal being that we will have community-driven research that is high priority to all stakeholders. Now, there are a lot of ways to get this going. These are just some typical steps, and as you'll see in a later part of this talk, we've done a lot of this already. One is to form a community advisory board. That's a group of interested citizens who meet regularly every other month or every quarter to advise us on what's important to them. Conduct listening sessions, focus groups, town halls to co-develop research design. What's the best way to do this? Is it a survey? Is it in person? What's going to work? To hire and train community members, people who are from there, to help us to get this information out into the community and get the information back to us. And then finally, to share and interpret results. As you can imagine, there are challenges to this. One of the biggest ones is that traditionally, many scientists have defined the problem without community input. So we have essentially decided that we know what the community needs and what questions they have without ever asking. Many studies don't engage the community as equal partners. Again, we view them as research subjects rather than research partners. And the community is really bombarded with these sorts of studies. Every health system has to conduct a community health needs assessment. And there are many colleges and universities who are doing studies. So we need to really ask them, what is the best way to engage you that isn't overtaxing? But why do we do this at all? Why does it matter? Well, we believe that community-based participatory research promotes culturally relevant, acceptable, and feasible interventions to improve health. It helps us to build trust. It leads to more sustainable health improvements because the community is more likely to adopt these suggestions if they've had input on how we figure them out. And finally, it helps us to translate research data into practice and policy. So this is the CEOC leadership team. Our whole purpose is here to help build the infrastructure for community engaged research and community-based participatory research. You can see me and Dr. Kidd, along with our co-investigators, Dr. Compton and Dr. Wright. And then on the bottom row, these are the really important people. These are the boots on the ground. Dr. Shantoria Ganya and Caitlin Stewart are our community health research coordinators. Dr. Ganya is in Louisville and Ms. Stewart is in Owensboro. And then we have two community health workers right now here in Louisville, Courtney Britt and Rodriguez Holt, and are in the process of hiring one in Owensboro. So with that, I'm going to hand over the presentation to Dr. Kidd, who's going to tell you some of what we've been doing. Thanks.
All right, thank you. Thank you. I'm going to share my screen. And everything will work out nice. Uh-oh, no. A little different.
You're almost as challenged as I am.
No, I'm usually pretty good at this, but this is a slightly different setup. So let me, oh boy. Okay, let me try it this way. Okay, how's that? Can you see my screen now?
There we go. Yes, now we can.
Now, do you see two slides or just one?
Just one. It says CEOC progress.
Okay.
And now we see two with you.
Oh, you see two?
Yeah. We see we see it, the slide, and we see you twice.
Oh, okay. Do you see one slide now?
We see now we see two slides.
Oh gosh.
Go back to what you had before, it'll work fine.
Okay. Okay. All right.
That works.
Wonderful. So what I'd like to do, and my name is Dr. Lucrece Kidd, co-director of the Community Engagement and Outreach Core, along with Dr. Kelly Bullard Dunn. And I would like to share with you our community engagement and outreach progress thus far. Back in, I want to say February, around the time that Shantoria was onboarded as our community health research coordinator, we formed a community advisory board, and which consists of about 12 members. And they are our community liaisons. They are the bridge between the community and the research institution. They are also, I guess, they're surrogates or they're voices of the community. We also, this past June, we conducted a community health needs assessment, and I definitely want to share some of the results with that. And I'm really thankful to our community health research coordinator, Shantoria, as well as Caitlin Stewart, who were the real drivers behind this. And then I would like to share with you some future directions to move things forward, or really to cause a shift in how we think about community-based participatory research as it pertains to clinical and translational research. So first, I'd like to begin with sharing with you the purpose of a community health needs assessment, which we did in partnership with our community advisory board members. The purpose of the CHNA, or Community Health Needs Assessment, is to better understand and respond to the needs and health priorities of the community by identifying their health concerns, um, while also recognizing existing community-based strengths and resources. It is designed to foster mutual respect, open communication, and a continuous flow of feedback between the researchers and the community members. In addition, the assessment seeks to uncover barriers and facilitators in, to engage in ultimately community-based participatory clinical and translational research. We hope to begin a dialogue on practical insights into how community engagement in clinical and translational research can be improved. Ultimately, the findings will guide researchers in developing respective collaborative partnerships that meaningfully involve community members as co-creators rather than passive participants, as my colleague has said previously. So for the community health needs assessment, our approach involved inviting our community advisory board members to serve as the voice of the community and change agents. For this needs assessment, we conducted a hybrid focus group discussion. That was a 90-minute in-person as well as online event. And we also, just to kind of make the online environment a bit interactive, we also conducted an online polls. And then we also conducted, after the focus group discussion, we had a 20-minute survey that focused on the participants' demographics, as well as information about their health background, their family health, and things of that nature. Most of the community advisory board members, all of them were African American women. On average, their age was 47, with a range from 26 to 70. About a third of them were married, a third were single, and then the other third were either widowed or divorced. These women, most of them had incomes of 50,000 or more per year. And these are largely very professional women, most of them residing in Jefferson County. One of the focus group polls that we had to do with, them ranking their top health concerns. Actually, this actually emanated from the survey, because the poll data was very, very scant. We didn't have full participation, so I decided to pull the data from the actual survey. And some of the top 5 health concerns in ascending order included chronic disease, as it relates to diabetes, high blood pressure, and heart disease, followed by obesity, asthma, cancer, and lastly, mental health. Now, we didn't, because the community, as Dr. Kelly Bullard-Dunn mentioned, because the community is bombarded by all of these community health needs assessments, we did not want to focus all of this session on just identifying health problems. So we decided to impart from a conversation with Tabitha Underwood, who is the Director of Community Engagement at um, um, University Hospital. We thought that, from communication with her, she mentioned to us, you really want to be a lot more uplifting with the community. So you definitely, as you're conducting your community health needs assessment, you might want to consider doing, like resource mapping, trying to figure out what are the resources that the community has already in place to address their identified health problems. This is a way of showing respect and just mutual concern. So anyway, some of the strengths that we identified or that we learned about the community strengths and as it relates to health and wellness in their community fell into roughly four categories: curiosity, a desire for health knowledge, cultural strengths around food and tradition, resourcefulness and community care, as well as resilience and strength through history. But I'm only going to focus on a couple of these, and they are in bold. So the first one I want to bring out to you is that, in reality, there's like this misconception that community members don't care about their health. And what we found was the exact opposite of that. In fact, the community is very eager to learn, and they are actively looking for ways to improve their well-being for themselves and their families, especially among children. We also found the community responds to adversity with creativity, mutual care, and innovative grassroots efforts like local farmers markets and community programs led by various organizations. We also inquired about, what are some of the barriers to participating in clinical and translational research and ultimately community, and which could ultimately impact future community-based participatory research. And one of the things that was identified is that information about research is not always accessible or presented in a digestible way, which can create barriers for learning. So we pose this question, how can we better engage the community in identifying and prioritizing their top health concerns? And there were several items that were identified. To strengthen the community engagement in research, it is important to involve the community members directly through focus group sessions, planning meetings, as well as our knowledge exchange sessions that we launched our first one earlier this month as community-based participatory research seminars, a series as we're doing now, as well as open dialogue that empowers the community members to express their health concerns, help define priorities, and co-develop solutions. Communication should be clear, simple, and approachable while recognizing the community's genuine curiosity and desire to learn. Trusted channels should such as churches, local organizations, and respected leaders can serve as effective partners, while safe spaces encourage open participation. As researchers, we need to offer flexible ways to encourage, to engage, whether it's in person, virtual, or other low tech options. This helps to ensure inclusivity. In addition, researchers need to provide fair compensation, recognition, and even pathways for continued involvement. We need to validate community members as experts, not just as study participants. That is a theme that came up at any opportunity to bring that in, to be co-partners or co developers or creators. They definitely chimed in on that. Finally, researchers need to adopt culturally sensitive approaches that address the unique needs of the subpopulations and acknowledge historical mistrust in research is critical toward building trust and fostering long-term collaboration. I think we need to have uh, a continued dialogue on how we can address this latter point, um, you know, under the certain climate that we find ourselves in. Next, we did run a poll in the group chat for the focus group meeting, and we posed the question, what changes would make the biggest difference in health outcomes in their communities? And you can see the several answers that they replied, but the two that stuck out most to me was making healthy food more available and affordable. And you'll find in some of the upcoming slides that there are actually community organizations that are specifically dealing with food insecurities in the West End. And the second thing uh, that stood out to me is the interest in promoting equity in health and a desire to reduce racial and economic health gaps. So as I promised, there are several organizations and community leaders that are addressing community health needs, including Change Today, Change Tomorrow, which is addressing food insecurity issues in terms of economic development and equity. The National Action Network is definitely a grassroots organization that's dealing with that issue. Play Cousins Collective, who's one of our board members, and you'll hear from her later within this community-based participatory research seminar. But she is the founder and CEO of Play Cousins Collective, and she does a lot of work surrounding the academic development of children and just providing support for young families with children. And I mean, the community, and especially in West Louisville, it's extremely uh, resourceful, and there are a lot of opportunities to be able to collaborate with community organizations on grants. One thing that I also will mention is the Louisville Urban League, because every time I turn around, this organization has something that they are doing as it relates to addressing food insecurity issues, economic development, creating jobs, helping people to gain homes, affordable housing. And more recently, they do have a grant offering to a $200,000 grant opportunity to combat childhood obesity. So this could really serve as a potential vehicle to help finance community-based participatory research. So then we also asked the community advisory board members, how can local entities better support community as well as health outcomes and things of that nature. And the things that they shared with us is that, local hospitals, clinics, such as Park Duval, as well as the West End Hospital, um, and as well as health departments and organizations like the YMCA, can better support community by building partnerships with churches. Okay, which, churches still remain trusted anchors and safe spaces for families. Churches not only offer spiritual guidance, but they also offer opportunities for youth programs, multi-generational engagement, and holistic community support, regardless of one's faith affiliation. Participants emphasize the need to re-energize these partnerships and harness the church's potential as a hub for outreach and empowerment. At the same time, health institutions must address toxic environments by improving customer service, cultural competency, and trauma-informed care to ensure that community members feel respected, welcome, and protected when receiving services. And I've even seen hints of this, on social media, where I'm kind of seeing people um, mentioning posts about this, making sure that they feel welcomed when they step into a hospital, whether that hospital is in the West End or if it's, you know, down here in the East End or in the downtown area. Okay, lose my place. Okay. We also ask questions about, what discourages community participation. And one of the major things that came up was a deeply rooted distrust in medical institutions. In fact, the 30% of our poll responders brought this up as an issue. Most of them feel that there's a long history of exploitation and inequity, and many also lack awareness of research opportunities or find that information is not communicated in accessible ways. In terms of lack of awareness of research opportunities, I just want to deviate just a little bit from these poll results and say that when we um, inquired about us for our survey, when we asked our community advisory board members, were they aware of clinical research opportunities in their community, or even local hospitals or centers? They all of them, 100% of them, said that they were not aware of how to go about getting that information. Most of them would, you know, and these are extremely literate, not only literate but health literate women, so they know how to acquire information through websites or reading published reports. But I found it pretty resounding that they these women who are very highly educated and extremely resourceful had no clue about the availability of clinical and translational, and never mind community-based participatory research at the University of Louisville. So we definitely need to shift that. So I mean, there were some other um, factors that served as barriers to community participation in research, including social determinants of health, access to transportation, childcare, things of that nature, and privacy concerns. There's a concern about, okay, what when you receive my health data or my private information, what are you actually going to do with that information? How is it going to be secured? How are you going to avoid any data breaches? And I think we just need to be transparent on that point. Okay. Then we also asked a question, what would build trust in researchers or healthcare? And 5 items were identified. You can gloss over those, but I walked away with understanding that building trust in researchers and healthcare institutions requires involving communities from the very beginning of the research process and treating community members or um, uh, as experts or co-creators rather than passive study participants or subjects. And that's really going to take a culture shift among us as researchers, right? Because we're quick to say, yeah, come on, and this is the purpose of my study. This is what we believe are the benefits and the risks. Yeah, come join my study. But they want to be more than just study participants, and so we definitely need to work on that. Also, there was a request to or transparency about research intentions, availability of funding, not only for academic researchers, but also potentially for community partners. Um, and they really stressed the need to understand community benefits. And they wanted to make sure that, they didn't mind participating in research, but they wanted to make sure that the research would eventually drive toward solutions to the community identified problems. And they really wanted to be involved in co-designing projects, from the conceptualization of the research idea, giving researchers feedback on their research or their research concepts. And they wanted to do that, maybe through focus groups or surveys and other types of assessments. And they feel like this kind of interaction between community, let's call them community experts and researchers, this helps to ensure relevance, accountability, respect, and trust. Okay. Next, we asked the community members, how can we, the community advisory board members, how can we get community members more involved in shaping health-related research? And there were 7 traits that were identified. And what I learned is that, some of this kind of echo of what I've already said. But definitely want to make sure that community members are treated as experts and co-creators rather than passive participants. And this means that we have to involve community members in the research process from the start to the finish. So that diagram that my colleague showed you earlier, where community-based participatory research or community engaged research, it is a continuum, and we need to make sure that we're inviting and engaging the community members in all stages of the research process. Do we expect that to happen overnight? No, it's going to be a process, but ultimately, within the next 3.5 years, like, yes, we would like to be in a place where we are mm, at the that we are the frontiers of engaging the community in clinical and translational research. Now, the community, though, they don't want to like participate for cheap. Like, they want to be fairly compensated as study participants. They also want um, stipends if they're being if their community expertise is being utilized for the progress of the research. Essentially, they just want fair compensation for their time. In addition, community researchers should receive academic credit. Some of these were interesting, and I'd like to, when we um, get toward the end, I'd like to have a discussion about how we're going to offer some of these incentives. But they want academic credit, they want certificates and recognition and publications, along with structured educational pathways that build research and translational skills. Like they are really trying to do some skill building there and get recognition for their efforts. And I don't blame them. So we also asked about what resources would you or the community need to increase participation in clinical research, and they identify some, practical resources like, access to technology, flexible scheduling accommodations to make participation feasible, educational resources. Some of those I've talked about previously, but they also wanted to receive workshops to help them to understand the research methods. So maybe we, as well as clear, accessible information about the research process. I've already touched on, financial resources, but they want funding for community-based research training and grants to support community research initiatives. I mean, they feel that they are boots on the ground, so they want they want the resources to be able to accommodate the great work that they are doing. In terms of infrastructural resources, they want events that are accessible. They want welcoming research venues, translation services as needed, and culturally sensitive research environments. Communication, that was really huge. They wanted to make sure that information about research, community-based participatory research or clinical research, they want to make sure that that information is easy to understand, and they want that information to be disseminated using vehicle various communication channels, including text messages, videos, um, social media. Yeah, they definitely wanted a multifaceted approach to communicating with them. In terms of systemic support, they definitely wanted to collaborate with researchers. They wanted recognition as community experts and a commitment, and this is key, commitment to actionable research outcomes. They don't just want to do research for research purposes. They want research that is going to be beneficial to um, their community. And in terms of the last point, building trust. In terms of building trust, they want to make sure that the research that they have that the research process is transparent, that there's cultural competency training for researchers, and mechanisms for continuous feedback. And they believe that commitment to community benefits demonstrates respect and accountability. And we do have some preliminary suggestions that the community is definitely interested in engaging in the research process. Back in September of 2024, we did a little survey of about 71 community members, and we found that probably about a third of them are interested in participating in research. Um, some of, about 20% of them want to become citizens. They want to help citizen scientists write grants. Essentially, they want to participate in various aspects of the research process. I guess I'll just share, what some of our study limitations are, and that is we had a small sample size, 8 African American women who are highly educated, and their income is definitely well above the median income here in Louisville. And so they may not fully their their thoughts may not fully represent the target population in terms of um, uh, health concerns, uh, health, what priorities, how to prioritize the community's health concerns, research priorities. And so we believe that we definitely want to work with our community advisory board to extend I'm gonna go to my future slide, to extend our efforts to um, different parts of Louisville as well as rural Kentucky. So we look forward to working with Caitlin with that endeavor. Um, and then, they definitely want educational. Yeah, we'll have to work, we have to figure out, hopefully we can work with our other community engaged outreach leaders here at the university to figure out, just creative ways that we can compensate our community experts, whether it's through, traditional, um, you know, university academic credit or certificates, and then we definitely want to connect or continue to connect community members with scientists. And, a forum like this can help in that regard. So we definitely need to continue our efforts in inviting the community to these types of seminars. And then we definitely want to work with the professional development core as well as the health research core. And I'm just going to call it the analytical course of um, research and design core, so that we can train and support citizen scientists in the different aspects of research design and just research process in general. In conclusion, the community is highly interested in health and health research. The community members, community organizations and leaders, they have lots of strengths and lots of resources that can really help leverage um, existing and new community-based participatory research. Um, I've shared with you different uh, barriers to research that need to be addressed. There are lots of different resources that our community experts have helped us to identify that could help facilitate community participation in research, not only as study participants, but as co-creators. And I think all of these efforts can go a long way in building trust and really just offering mutual respect to community members who are really doing the work in terms of improving health outcomes in their own community. I want to, just offer this slide for acknowledging um, the leaders of the Louisville Clinical and Translational Research Center, all of our community engaged outreach team members, our community members, community partners and experts, and lastly, our professional development and administrative core leaders um, and staff members. I do want to just give a shameless plug and say that we do have some upcoming community-based participatory research seminars, and we are definitely trying to uh, put our money where our mouth is. And so we've worked with Christy Trutman so that we can extend a invitation to Kristen Williams, who's the founder and CEO of Play Cousins Collective, who I've talked about previously. She's going to give a seminar on January 27th and February 24th, and really to shed some light on how community members or experts and researchers can share power in this community-based participatory research space. So thank you. I think we have a little bit of time for some questions. I look forward to uh, a continued dialogue. Thank you.
If anyone has any questions or comments, you can use the Q&A, or I think you should be able to unmute your mic as well.
Yes, we answered everything so eloquently.
It's a quieter bunch than usual. It's a quieter bunch than our communities.
Well, I would like, yes, because our community, oh man, you would think that they would be silent, but they are very active. But I have a question for you guys, and that is, one of the things that the community raised is, to make sure that, when we're trying to engage the community in research, they want to make sure that like that research is not only responsive to their community identified health concerns, but they want that assurance that that research is going to be, culturally appropriate, as well as, um, you know, like their needs and concerns are respected. How do we do that? You know, in this current political climate that we find ourselves in, and not get ourselves in trouble. And I've been hustling with that, and I'm just curious what your thoughts are on that.
Dr. Key, there are actually some questions coming in,
Uh,
and I feel like based on what you just asked, there may be a connection there because one question is actually kind of asking you the same thing. So I read it from Carmen Mitchell. It said she said she came really late. She's sorry, but she wanted to ask a question related to the part about community members wanting to make sure research was leading to action. So her question is, or their question is, what are some effective ways researchers and academics can demonstrate that commitment to action when so much of whether research recommendations translate to solutions is depending on things happening within other organizations?
so we don't have. I'm going to start off with an answer, and I know my colleague is probably going to come up with an even better way to answer this. And I'm going to just say, like off the dome, I don't have an answer. Okay. But that's okay, because, and that's why we are creating this space between our knowledge exchange session where we invite the community in to share their voice, find out what research is going on. I feel like that's a first step. It speaks to transparency. It speaks to respect. It speaks to the possibility of opening the door for possibility for future collaboration. And even this, the community-based participatory research seminar, one of the things, even though I would probably say, really over the past 5 to 10 years, and Kelly, you can correct me if I'm wrong, there's been a shift or an increased interest in community engaged research. I don't think we're not quite at the place where we're doing true community based participatory research where there's like an equal partnership between the community and researchers, so that we can make sure that the research is creating research that is going to provide solutions to the problems. And so through this seminar series, we're hoping to educate our researchers as well as citizen scientists and community members to just kind of create that environment where we can co-create, co-design, and co-solve together.
Yeah, I completely agree with that, Dr. Kidd. I think one of the things about guaranteeing that these studies that we do result in action, result in change, result in something that is effective in the community depends upon knowing what the community wants to have happen. Because, we can take our results and think that we're implementing change. And if it isn't what the community sees as necessary, if it isn't a community priority, if it isn't something that's actually going to work in their community, then no matter what we do, we're not making the kind of progress that really is going to be important. So I think that's part of it, is just asking, we want to study childhood obesity, or we want to study type 2 diabetes. What would you like the outcome to be? What is, we all say we want healthier communities, right? Of course. But what's the next step? Do you want more access to monitoring? Do you want more access, it's come up multiple times, to healthy food options? Do you want us to it's come up multiple times, to healthy food options? Do you want us to really look at the food deserts? Things like that. That I think for a long time we've come up with what we think are the right answers without ever asking the community, what do you want to see happen?
That was a very, very good question. And it's probably one that's going to haunt me, and I'm probably going to lose sleep over it. We probably could write a whole paper trying to respond to that question. So thank you so much for that question. Are there any other questions?
There's a comment from Michelle Cunningham. Says, I think you just have to treat people as humans and not through a political lens or approach.
Yes, I agree.
100%.
That is so profound, like very short and precise, and it hits the nail on the head. Thank you. I think we have time. Go ahead.
Yeah, I'm not sure if this was discussed or not. I was sort of looking at the settings. But Carmen followed up with an example that I thought was really interesting. And I don't know if it was discussed, but for example, she said if there's a systems change within a hospital, new laws that need to be passed by policymakers, and thus you would need advocacy, lobbying, which are things the university researchers, usually are not a typical part of their job scope. How does that work exactly?
I think we do have some people in policy within the School of Public Health. So it'd be interesting down the line, as a possible solution to make sure that we or researchers are reaching out to people who are involved in in policy related stuff, and see if they can begin to like translate some of their research into policy. Or maybe what we could do at the last event where we're going to have a panel discussion, maybe we could involve one of the lawmakers like Gerald Neal to come to maybe speak to that and help us figure out, okay, we have some great ideas. We have some amazing research on how to combat, I don't know. I don't know, pick a topic. Fight gun violence, or fight drug addiction, or whatever, how can we like translate that to some sort of policy? I don't know, it's just an idea.
Yeah, I agree with that. We do have government relations folks at the university, and then people in the Kent School of Social Work and Public Health, as well as the other health sciences schools that do this. But the other thing I would say is that, as we're finding out what the community wants to see happen, and we have the data to support how to do that or what to do, that really will inform our talking points both in Frankfurt and in Washington, so that we are all in alignment with what we are asking for, right? Because if you have the university on the one side, asking for something that's totally different than what the community wants, neither is going to be particularly successful. So if we can use these data to help inform what policy changes need to happen and be in alignment, I think that is something that I would think might be of benefit.
And to your point, maybe we need to make a concerted effort, speaking to our community liaisons that are on here, that we need to reach out to some people who are in the policy space, whether they are lawmakers or academics, make sure that they attend these sessions, because they would be able to better help us to translate the research to policy and change.
Another comment from Michelle Cunningham. We should look at studies of areas that have not been done in our area already. So often there are studies done that have already been done before, and there's information already out there about it. And so often we lose focus on the needs that aren't being met. And then we have Carmen says, thank you. Now that we've learned this, what do we do? Question haunts her too. And then we have Sherry. I think I'm saying that right. I hope so. Where will the sources of funding come from to support these initiatives?
That's a very good question. So there is one initiative that I kind of briefly mentioned with the Urban League. You can go to their website, Louisville Urban League. They do have an initiative to combat obesity among children. And what's so amazing about it is that they actually have partnered with a venture capitalist firm. So yeah, and it says $200,000 for about a year of support. And if you do find some success in addressing childhood obesity, they're going to give you an additional $225,000 to be able to scale up. And then we don't have our budget approved yet, but we're looking to see if we can have some additional funds awarded to our community engagement and outreach core, so that we can help fund some community-based or community engaged or community-led research projects. So we'll see. We're working on it.
And again, this is where the partnership is really important, because we are constantly scouring what we know of as our resources, and including governmental sources of grants and support, as well as philanthropic organizations. But the community can help with that. And again, with the alignment, whatever we're proposing, I think will become much more attractive to people that want to fund it.
Yeah. Can I restate that? Not restate it, but I want to embellish what you said. You can think of the Clinical Translational Research Center, and then our core and community engagement and outreach. View us as a scaffold. Like, we have the infrastructure, we have the resources. If you partner with us on grants that you find, it's going to make you that much more competitive. So, yeah. And if you have more questions about that, just message me.
And we have a question from Bryce. How do we avoid alienating community by focusing on getting a solution? I think it is often the case that at the ground, there may be 3 or 4 preferred solutions within the community, and at times they could even be solutions that are at odds with one another. So if we try to satisfy with a single solution, even when working closely and in good faith with the community, we might end up with a recommendation or solution that is entirely unsatisfying. So how do we avoid alienating community by focusing on getting a solution?
That's a good question. I don't have the answer to that. You're, you're not going to please everybody, you know. And when when you're laser focused, you have to be laser focused on a particular proposal. But you know, not one person has all the solutions. So maybe that's where you bring in many different partners and people attack the same problem, but using different approaches. But I don't know.
Yeah, I agree with that. And we're inevitably going to have some conflict in that because we're a community of diverse opinions, right? Um, but in identifying that, there may be an opportunity to bring those stakeholders, those constituents together to work on, is there a common solution? Is there area of overlap that we can find common ground and work toward this? Or are they, in fact, outcomes that are directly in conflict, in which case, we can do one and not the other. So it's never going to be perfect. It is never going to be perfect, but perhaps this will provide a structure for better conversation, better collaboration.
Mhm. And a lot of times, like when we write our grants, right, we will put forth a solution, but then they have something that's called pitfalls and alternative solutions. So if solution A does not work, then you propose within the context of your grant solution B and solution C. So there's a way around it, you know. When you have multiple solutions, that's actually a good thing. I don't even really see that as a bad thing. Yeah. Okay.
I believe that is our time for today.
All right. Thank you, everyone.